This section will conclude veterinary dental radiographic positioning and technique. So let's walk through what we just did. You saw the caudal maxilla. The next shot in the sequence would be the maxillary canine tooth. We set the tube head at 60 degrees. As you see here, we're shooting that from rostral to caudal in an oblique orientation, just like this tube head shows. Here's where the film goes. The patient's palate's parallel to the table, and there's your radiograph. It's what it's going to look like every time. The next shot is extremely simple. The incisor view, there's the film orientation, 45 degrees, tube head directed at the incisors at the film, and then there's the shot that you end up with. And the same thing as you proceed through the left. You'll get the left maxillary canine, and then you'll get the caudal cheek teeth on the left side, just like you did on the right side. Then working on the mandible in the same sequence that we did when we showed the video just now. We have that parallel technique, and in this particular cat, we have probably a larger cat, which allows us to put that sensor a little bit more oriented like this, where it is actually fairly parallel to the ventral mandible. That's not going to happen most of the time. What's going to happen most of the time is that this is going to be up here, and that's going to be down here. That's going to be up here. So it's going to be rotated a little bit more, because we just can't get the right orientation because the mouth of the cat's too small, and that's okay. Again, you saw where we cut off that mesial root on that third premolar that one time prior, and we always get that with the canine shot. So we'll show you that in a second. So again, parallel technique, extremely easy. There is no angle. All you do is shoot it parallel to the film and sandwich that mandible in between the tube head and the film, just like we did on that parallel shot on the dog with our general x-ray unit. And then the canine tooth, we set that at 70 degrees, rostral to caudal oblique. Here's the tube head position, there's the film position, and then you can see here, not only do we have the canine, but we've got that mesial root on that third premolar. We've also got the fourth premolar and part of the mesial root on the first molar. So you always are going to get that with that rostral caudal oblique shot on the canine on the mandible. So you don't have to worry about trying to get that with that parallel technique. And then finally, here's the incisor view. And if you notice that this sensor has not moved a bit, it's stayed here for the last three shots. So not only do you not have to move the patient for the whole mandible, you don't even have to move the sensor for the second, third, and fourth shot here with the canines, the canine, the incisor, and the other canine. So set that at 45 degrees, just like we did in the maxilla, and very easy shot. The other benefit of this shot in the mandible, because of the orientation of the apices of these roots, we don't have, like we do in the maxillary incisor shot, superimposition of the apices of these tooth roots over other structures. They're clearly visible here because there's no superimposition over the other teeth. And so that gives us another view of the apices, which is very valuable if we've got a tooth that we're considering that might be compromised, or compromised from fracture, or from tooth resorption or periodontal disease.